question. I don't know, Matt, if you can see that. Yeah.
Yeah. Yeah. Do you recommend everyone starting off with condition 3 exercises? I like it.
I love that. Why don't we just jump in and start there?
Sounds great. Sounds great.
Yeah. We should probably start by explaining what condition 3 even means.
Yeah. And then 1 and 2 as well. Yeah.
Yeah, exactly. Just 3, and we don't even talk about 1 and 2.
Yeah.
Matt, do you want to just like start with some info on that, and then we can go from there?
Sure. Yeah. So we classify common deviations or postures that we see with condition 1, 2, or 3. And just to kind of keep it simple, condition 1 is somebody who we see come in who's very like strong. So they're very open but forward in terms of the posture, meaning from the ankle position, we see like hip, knee, shoulder slightly forward into a forward pitch, and with the pelvis, which is a big area that we classify with, we call an anterior tilt, where the front is lower than the back. So if you think of your pelvis like a bowl, with my thumbs being the back side here, it's tipping forward. Condition 2 is when we see, and the biggest postural deviation, we'll see that as a rotation or a twist, whereas somebody is asymmetrical or imbalanced from left to right, where condition 1, they're balanced, but they're deviated in a balanced way. Condition 3 is if you think of, people you see walking down the street who are very hunched over, so very rounded in their spine. And then going back to the pelvis as a classifier, and same example, like a bowl, except now the thumbs are lower than the back, called a posterior pelvic tilt.
And they have a bit of like their profile view is going to be a little more of a C shape, if we're making a blanket statement. Yeah, a little like that, right? Whereas Matt, since you're up, an anterior, a condition 1, strong, tight. A lot of people who are like athletes, weightlifters, for example, runners, things like that. If Matt were to demonstrate the condition 1, yeah. So that would mean that they have their hip flexors are going to be shorter and tighter, whether it's because they are constantly flexing like their quick twitch muscles. Like I said, runners, sprinters tend to have this posture, and usually that's classified with active people, athletes. Thanks, Matt. That's super helpful.
Yeah, and just for people to visualize, if they were jumping onto that pelvic bowl example I was using, where the thumbs are the back of the pelvis, talking about that from the side view. So like you said, the anterior pelvic tilt is when the bowl is tipping forward. Posterior is when it's tipping back like that.
Exactly.
And then with the condition 2 for people too, if we're using that same example, because the pelvis is not one big bone, it's 2 separate bones that are joined together by ligaments, that both halves can actually do something different left to right. So with condition 2, see that one side can either be more forward than the other, causing a tilt, can be more backward than the other, causing the rotation. So it's just an asymmetry in the 2 halves that typically leads to a twist or rotation mechanism.
Right. And it's also true too in terms of imbalanced for condition 2. That can also mean like there's rotation and then there's elevation, like an elevation of a shoulder, an elevation of a hip. And it can be easy for you to probably look in the mirror and get a sense of where you might lie within those 3. And sometimes people are a combo, like more often than not, people are a condition 2 because there is an imbalance somewhere. That can lead to, feeling like if you're getting your suits tailored, one sleeve has to be shorter than the other. And that's usually because of a shoulder elevation, not because your arm is 2 inches longer than the other one.
Right.
What if you are all 3? Right. So we are, that's where that 1 and 2 or 2 and 3 come in. So I think this would be, are you asking this also because of how much we are sitting these days? Because that would make a lot of sense if you're thinking like probably a lot of people are condition 3 because we're sitting down. Most people at a desk are rounding their upper back and shoulders, and we're not using our hips. So I think if I'm assuming correctly and why you're asking that question for the masses to start with condition 3, I understand why you would be asking that.
Yeah, and like you said, I mean, it can be a combo. Typically, people are conditioned like 1, 2, or condition 2, 3, or things like that, because you have that rotation, like you're saying, with that posterior, anterior, pelvic
Yeah.
tilt. So you certainly can be all three, in that sense. And yeah, we don't necessarily recommend everybody doing condition 3 exercises because everybody's so different. You can't It's a one size fits all, just cookie cutter thing that we apply to everybody because everybody's so different. Typically, though, like you said, most commonly people are conditioned to or have some condition to some twist or rotation. That's usually the first thing that we want to mitigate.
Yeah, I would say the it's a tricky dance because Egoscue has this unique individual whole body approach. So we look at each person and their movement patterns, their compensations, their deviations. We put together exercises specific for that individual. That said, we have a book, Painfree. We have Egoscue Health Through Motion. We have several other books that in a way are there for everyone to try. And
Yeah.
so definitely great to try those out, but also keep in mind, maybe not every exercise is going to be super applicable to you. I think generally speaking, it is safe to say most people, if you're saying, what if I'm all three, or what if you're all three, then you definitely are a condition 2. There definitely is an imbalance. So if you were to start somewhere, starting with a condition 2 menu in like the Pain-Free book or the Health Through Motion book would be a good jumping off point, right?
Right. Yeah. And the most effective thing would be getting a personalized menu from the Egoscue clinic closest to you. You can see us, Beverly Hills or Boston, and we see people on Zoom, or Skype, or we're doing virtual therapy, or, we have in-clinic times available too. So that's where you're going to get the best results. If you do find that you're all three, or if you're one or 2, or, just one of them. So we can help you understand and discover which one you are, and then give you an exercise sequence, we call a menu, that's specifically tailored to your body and your movement pattern specifically.
Yeah, perfect. And the book is a great resource and a great jumping off point. It also is a great way to get introduced to the method and our approach, and how a lot of times people will think, okay, well, I have shoulder pain, so I need an exercise for my shoulder. And when you jump into these menus, you're like, I'm doing a lot of hip work, right? And we start to see that your pain is not the site of the dysfunction.